So today we're going to cover some cardiovascular system. The first thing I want to talk about is something called cardiac output. Now, cardiac output is defined as the amount of blood you pump out of a ventricle per minute. So if we look at the formula for that, it's cardiac output equals the heart rate, which is how many times you beat per minute or how many times you contract the heart per minute, times something called stroke volume, and that's the amount of blood you pump out of a ventricle per pump or per beat. And so we put that together, we get the cardiac output. Now, stroke volume also can be seen in a formula or a formula equation type form, whereas stroke volume equals the end diastolic volume. So that is the amount of volume. Diastole is this relaxation period. So when the ventricle is relaxed, at the end of relaxation is when the ventricle is most full. And so then minus the end systolic volume. Systole is contraction, so when the ventricle contracts, it ejects the blood, and whatever the volume is at the end of that contraction is the end systolic volume. And so if we take the end diastolic minus the end systolic, so basically how much we filled it, okay, minus how much is left, we get the stroke volume, how much we actually pumped out per that specific beat, okay, or that specific contraction. Now, there are three key things that affect stroke volume. And the three key things that affect stroke volume are preload, contractility, and something called afterload, okay? The first two are direct proportion to stroke volume, and the third, the afterload, is going to be an inverse proportion to stroke volume. So let's talk about what they are. Preload is the ability of the ventricle to, as it expands more, it stretches more, it has the ability to generate more force on contraction. So think like a rubber band, right? The more you pull it back, the more force it contracts with. And so the ventricles are like that as well, where as we expand the ventricle, the more it expands, the more force of contraction it has to eject the blood. So that means that if we increase this preload, we increase the stroke volume, how much blood we're actually pumping out of the ventricle. Okay? And so what will do that? Well, increased blood volume will do that. So when you exercise, the veins, they go to the heart, they dilate, and you get more blood back to the heart, so you're going to wind up getting more filling of the ventricle. More filling means more stretch means more preload, and more preload means more force of contraction, thereby increasing the stroke volume. Another example would be if you have a slower heart rate. Right? So when the heart rate is slower, you have more time for the ventricle to fill, so those breaks between beats, the ventricle fills more. If it fills more, it stretches more, and again, the same process, right? We get more preload, which gives us a higher stroke volume. The inverse of that is as we increase the heart rate, if the heart rate's fast, then we have less time to fill the ventricles, and so then we get less stroke volume, okay? Or if you have something like blood loss, you're not getting as much blood back to the heart. Less filling, less stretch means less preload, and of course that leads to less stroke volume. Now, Frank Starling law of the heart says basically this principle that as we stretch, the more we stretch the ventricle, the more force of contraction we're going to get. And Frank Starling law of the heart also says that out of the three factors that affect stroke volume, that preload is the most significant of the three factors affecting stroke volume. So let's talk about the other two. The other two factors are contractility and afterload. The contractility is anything that causes a change in contraction of the heart muscle, so increases or decreases contraction, not including stretch. So in other words, we can increase the contraction of the heart, but it doesn't have anything to do with increasing that preload or increasing that stretch. Then it would fall under this category of contractility. And the same thing is correct in reverse. If we have less contractility, as long as it doesn't have to do with less filling, less stretch, then it would fall in this category of contractility. Now, if something increases the contractility of the heart, then it's called a positive inotropic factor. So things that are positive inotropic factors are things like your thyroid hormone, thyroxine, or things like epinephrine and norepinephrine, which are sympathetic nervous system hormones that cause that fight or flight response. So all of those things will actually stimulate an increased force of contraction of the heart muscle, and by increasing the force of contraction, of course, you'll eject more blood, which means you'll get a higher stroke volume. So as we increase contractility, we increase stroke volume, okay? Some things that will decrease contractility of the heart are things like acidosis, extremely low oxygen, so anoxia, things like that will cause decreased contractility of the heart. Calcium increases contractility of the heart, so it's positive inotropic. A negative inotropic factor are those things that decrease contractility of the heart. So the anoxia, the acidosis, calcium channel blockers, these are things that would decrease contractility, which means they decrease stroke volume because the force of contraction is less. Okay. The third factor is an inverse proportion to stroke volume. That's called afterload. Afterload is the force, friction, resistance we have to overcome to get the blood out of the heart into the vessels. Okay, so out of the chamber into those primary arteries coming out of those chambers. And so there is a resistance that we're going to encounter that's called afterload. So as that afterload increases, that means the resistance getting out of the heart increases. That means we're going to get less blood out of the chamber, which means we're going to decrease stroke volume. So as we increase afterload, we decrease stroke volume. If we were to decrease afterload, we would increase stroke volume. So we decrease the resistance coming out of the heart, then more blood would actually be able to be pumped out of the heart. Things that will increase afterload are things like hypertension, which is high blood pressure, things like atherosclerosis, that we'll talk about more in future videos. So those are things that affect, that's some of the physiology from the cardiovascular chapter that I believe is important, talking about cardiac output, talking about stroke volume and the things that affect stroke volume. If you have any questions, let me know. Stay strong. I'll see you next time.